Hi, Jackie Pritchard. How are you doing today?
I'm good. How are you?
Good. My name is Samantha. I'm your postpartum nurse today. First, I will be taking your vital signs. I'll start with your temperature, which I will take orally, and it is 98.4. And then I'll go ahead and assess her pulse, and it is 87, which is perfect within normal limits. And then her respirations are also 18, which is also great. And the blood pressure will be on his right arm, bicep, and it is 132/80, which is also, we are good to go there. On a scale of 0 to 10, what would you rate your pain, 10 being the absolute worst?
2.
2, perfect. I would then listen to his breath sounds. And they present to be clear without crackles and are full. And then I would then go ahead and palpate her breast tissue in a circular motion and make sure you're not pushing too hard and with the flat part of your fingers, not the tips. And then I would then mention if the tissue is soft or hard or if there are any warm spots. There are no warm spots. The breast tissue is soft, not too hard, not engorging too much right now. And then nipples are intact and out. And is there any tenderness while I press here? No? Good. And then I will flatten the head of the bed. Okay. And then I would then palpate the uterus. I would start at the very top, measure with 2 fingers. I'd find it here, and so it's been about 1 hour after delivery, so the fundus is midline and palpable. And it would be palpable at the umbilicus at this point. Since it's been 1 hour, it shrunk a little bit, especially with breastfeeding for the first time. That helps with shrinking the uterus itself. Then I would go ahead and listen to her bowel sounds, which I will do now in all 4 quadrants. Okay, they seem to be very active. Jackie, when was the last time you passed gas?
About 8 hours ago.
Okay. When was the last bowel movement that you remember having?
12 hours ago.
Okay. We will work on that. Would you like a stool softener of any kind? Or would you like to wait on that, maybe move around and see how that goes?
That's fine.
Okay. When was the last time you voided? You urinated?
Oh.
Mm-hmm.
Probably about 2 hours ago.
Was it painful? Was it hard to? Did it burn at all?
No.
Okay, so you don't think you have a UTI present. Okay, I'm going to have you turn on your side this way. Now I'll be checking the lochia, which is the scant or mild to moderate or severe bleeding that there can be and will be after you give birth. So I would then check the amount that's on the pad. And I would also check immediately about at 1 hour postpartum. And so as I can see here, there's rubra. So this is the first bleeding that you have after delivery. So there's red blood, shreds of fetal membranes that are still in there, lanugae, vernix mucosa. There's no blood clots so far that are seen, and no foul odor. Okay, and then I will then check her perineum and follow the Rita assessment. So that is redness, oedema, ecchymiosis, discharge. There is no ecchymiosis. There's some discharge, it's more serous fluid, nothing too serious. There's some redness, which is to be expected after giving birth, but we'll keep an eye on that. There are mild to moderate hemorrhoids also. Nothing too severe, but we'll also keep an eye on that and give a stool softener if that will make passing poop easier later. And she did not have an epidural, so there is nothing to check out for at the spinal site also for Rita. So I'll have you go back on your back, and then I would then check for DVTs. So I would look for any swelling, redness, any pain, warm spots, and especially calf pain. Do you have any calf pain? Okay, wonderful. How have how do you feel postpartum, emotional wise? Let's see, what would you say your emotional state was?
Okay.
You feel good? Good. So I'd like to teach you a couple things, which is normal to do postpartum. So I'd like to let you know that there's no sexual intercourse within the first 6 weeks postpartum, as well as I would not recommend using any tampons. It's the same type of thing. You don't want to irritate the open wounds in there. And then call if you start feeling down on yourself, which can be common with postpartum. We'll give you a quiz before you leave the hospital. And then since you plan on breastfeeding, make sure to keep up on your nutrition, your fluid intake to keep your supply in demand as your baby's demand. And then if she were to have had a C-section, I would check her IV site, which every patient does have it, but first I would check her IV site, and it's subacute in her left antecubital. There's no redness, no swelling, no edema, no leaking, nothing like that, no coolness. And then I would also check her Foley site, since if she were to have a C-section, as with an epidural, you wouldn't feel anything from, the trunk down. So of course they'd have to have a Foley, and if, she would have one, it is intact and clean in the same spot we put it in. And then I would also check the dressing and the incision at the site, and it's intact, clean, no drainage. The dressing is dry, and then the incision is also clean and still intact.